Regional anesthesia, like epidurals and nerve blocks, is generally safe and effective for pain control during and after surgery. These techniques involve injecting an anesthetic near nerves to numb a specific region of the body. While complications are uncommon, it's crucial to understand that neurologic injuries, though rare, can occur and have serious consequences. These injuries can range from temporary numbness to permanent paralysis, impacting a patient's quality of life. The good news is that advancements in anesthetic techniques and monitoring have significantly reduced the incidence of these complications. However, the potential for neurologic injury after regional anesthesia underscores the importance of vigilance, early detection, and appropriate management. Recognizing neurologic complications immediately after surgery can be challenging for several reasons. First, patients are often sleepy and groggy from anesthesia and pain medications, making it difficult to assess their neurological status accurately. They may not be able to communicate their symptoms clearly or at all. Second, the effects of anesthesia itself can mask neurological deficits, making it seem like the patient is recovering normally when there might be an underlying issue. Third, some neurologic injuries develop gradually over hours or even days, making it essential to monitor patients closely even after they leave the recovery room. Neurologic injuries after regional anesthesia can manifest in various ways, impacting both sensory and motor function. Sensory deficits involve changes in sensation, such as numbness, tingling, or pain. Patients might experience these sensations in the area where the anesthetic was administered or even in more distant parts of the body. Motor deficits, on the other hand, affect movement. Patients may experience weakness, paralysis, or difficulty coordinating movements. These deficits can range from mild, like a slight limp, to severe, such as the inability to move a limb. Section 4. Mechanisms of injury. Neurologic injuries following regional anesthesia can occur due to various factors. Direct needle trauma during the procedure is a possibility, although this is relatively rare with the use of ultrasound guidance. More commonly, these injuries result from the anesthetic medication itself, either due to its toxicity or the pressure it creates within the nerve. If the anesthetic is accidentally injected into the nerve or a blood vessel supplying the nerve, it can cause significant damage. Compression of the nerve, either by a hematoma, which is a collection of blood, or the anesthetic solution itself, can also lead to neurologic injury. Section 5. Evaluating post-operative neurologic complications. Evaluating suspected neurologic complications requires a comprehensive approach. The first step involves a thorough patient history and physical examination. Doctors ask about the patient's symptoms, the type of regional anesthesia used, and any pre-existing medical conditions. A physical exam focuses on assessing sensory and motor function in the affected area, comparing it to the unaffected side. Nerve conduction studies and electromyography, or EMG, are valuable tools to pinpoint the location and extent of nerve damage. These tests measure the electrical activity of nerves and muscles, helping doctors determine if the injury is to the nerve itself, the muscle, or the connection between them. Imaging studies such as MRI may be necessary to rule out other potential causes of the patient's symptoms, like a spinal cord injury or a herniated disc. Section 6. Treatment and prognosis. Treatment for neurologic injuries after regional anesthesia depends on the severity and underlying cause of the injury. In some cases, the injury might be temporary, resolving on its own within hours or days as the anesthetic wears off. Conservative management, such as pain relievers, physical therapy, and observation, is often sufficient for these cases. However, more severe injuries may require surgical intervention. For example, if a hematoma is compressing the nerve, surgery may be necessary to drain it and relieve the pressure. Early diagnosis and intervention are crucial to improve the chances of a good outcome. The prognosis for neurologic injuries varies widely depending on the type and severity of the injury, the timing of treatment, and the individual patient's overall health. Section 7. The importance of early detection and management. Neurologic complications following regional anesthesia, while uncommon, can have significant and long-lasting impacts on patients' lives. Recognizing the barriers to early detection, understanding the mechanisms of injury, and employing appropriate evaluation and treatment strategies are crucial for mitigating the potential risks associated with these procedures. Early detection and prompt management are paramount to improving patient outcomes. Patients should be educated about the potential risks and benefits of regional anesthesia, and healthcare providers must remain vigilant in monitoring for and addressing any signs of neurological complications. By working together, patients and healthcare providers can help ensure the safest possible experience with regional anesthesia.